Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 media briefing conference call. At this time, all participants are in a listen-only mode. After the speaker presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I would now like to hand the conference over to your speaker today, Ms. Andrea Anneman. Thank you. Please go ahead, Madam.
Thank you very much. Thank you all for joining us for the COVID-19 media briefing for December 23rd. On today's call, we have MDH Commissioner Jan Malcolm and MDH Infectious Disease Director Chris Erzman. After some updates from Commissioner Malcolm and Director Erzman, we will open up for questions from reporters on the line. With that, I will turn it over to Commissioner Malcolm.
Thank you, and good afternoon, everyone. The global and national numbers increasing in cases and, unfortunately, deaths just absolutely continue at an unabated pace. And so that's just important context for us to understand at the state level. In the United States yesterday, an additional 194,000, almost 195,000 cases and 3,383 additional deaths just in one day. Here in Minnesota, we are reported this morning, 1,513 cases on yesterday's test volume of 23,563 tests. This brings us to a new total of 402,519 cases since the start of this pandemic. Over this time, a total of 20,963 people have been hospitalized. 4,474 have received intensive care. There are currently 1,073 people currently in Minnesota hospitals with COVID-19. Of those, 238. We had another 75 COVID-19 deaths reported to us yesterday, for a new total of 4,971 deaths since the start of the pandemic. So it's sadly pretty likely that we will cross that very sad threshold of 5,000 total deaths, likely tomorrow. In yesterday's reported deaths, there were 37 in the metro area and 38 in greater Minnesota, ages ranging from 57 to 99. As we've talked about the last few days, and happy to see that the data continue to show some encouraging trends with lower numbers of cases, lower numbers of population-based case growth and hospitalizations, although any cases are cause for concern, and certainly the mortality statistics continue at a heartbreaking pace. The measures we put in place in November to limit the spread of disease and to bring the trajectory of this pandemic down have had some positive effects. And that's because of the hard work that so many Minnesotans have done to really take the prevention guidance seriously and to be careful with our interactions while there's so much virus spreading around the community, and because of the sacrifice of many Minnesota businesses. And for that, we thank you. And your neighbors thank you. And we just want to keep reminding that this is important, not just to protect yourself and your immediate family, that is important and critical as that is, but also about protecting your neighbors and the people in your community that you don't even know, people who may be someone who cares for someone who is most vulnerable. As I mentioned, we're too fast approaching 5,000 deaths in Minnesota. And what a sad time of year to think about 5,000 families not loved ones with them during these last days of the year, during this holiday time. The actions that we're taking all together now will help us to prevent the loss of more people or having people suffer serious health consequences that we know this virus can cause. The things that we are doing to bring down these numbers have very, very real consequences in people's lives. And certainly the fact that vaccination is beginning for our healthcare workers and our long-term care residents is a very significant development in the course of this whole pandemic. And in time, we expect that vaccination will help drive these numbers down even further. We have to keep taking steps now to help prevent the spread and keep it under control, to help the vaccine do its job as more vaccine becomes available over the next several months. So as we've been saying, now is not the time to let down our guard. These numbers have fallen because of what we've done, and it's important to keep paying attention to practicing social distancing whenever we're with people that we don't live with in our own immediate household, to wear our masks when we're out in public, to avoid large gatherings. And we know that's not what any of us want this holiday season, but we continue to urge Minnesotans to be cautious with our gatherings and to limit indoor social gatherings to 2 households with no more than 10 people, and trying to maintain that 6 feet distance apart from anybody that you don't live with. Limiting outdoor social gatherings to 3 households with no more than 15 people remains the guidance. Again, paying attention to social distancing of 6 feet apart from anyone outside your immediate household. And it's so helpful to be mindful of social distancing and mask wearing anytime you're together with another household, during any time when you're not actively eating and drinking. And as you consider holiday gatherings, consider virtual gatherings as a way to stay connected with the people that you love. It's a good way to help keep everyone safe, but to have some ability to connect. If we continue to take these precautionary measures, we will get to the other end of this pandemic sooner with fewer debilitating illnesses and losses of life. With that, I will turn it to Chris Erzman to give us a current update on vaccine rollout. Thanks, Chris.
Thank you, Commissioner. Today, we've added some COVID-19 vaccination data to our website. We've added a page for vaccine distribution data and a page for vaccine administration data. Distribution and administration data will be updated weekly on Wednesdays, and the frequency of updates, particularly for administration data, may change as more vaccines are given. We get weekly allotments, and so that will be less likely to change. For vaccine distribution data, these data reflect doses allocated to registered providers in Minnesota. With the hub and spoke model that we've talked about, vaccine is sent to the hub and then may be redistributed to other sites or the spokes. Some of these doses are arriving at their final destination this week. The doses administered data represents all the doses administered to Minnesotans and reported to the Minnesota Immunization Information Connection, or MIC, the state's immunization information system. Registered providers receiving COVID-19 vaccine are required to report to MIC within 24 hours when they administer vaccination. Organizations that receive federal allocations do not have to report vaccinations to MIC, but they submit their data directly to the federal government. Having said that, there are some sites who get vaccine from other allocations that may still report their doses administered to MIC. So we are including all the doses reported to MIC in our administration data. Because of this, there may be some differences between the vaccine administration data and vaccine distribution data. It's not exactly a one-to-one match. And I also want to acknowledge that there is a delay in reporting. While we have a lot of vaccine allocated to Minnesota, as can be seen with the distribution data, you'll see that the administration data seems lower. That's because actually receiving, preparing, and administering vaccine takes time. It takes time for the vaccine to get into the state. For example, with the Pfizer vaccine, we didn't receive all of our allocated doses until last Friday. And then some of those doses had to get redistributed to the other sites, the spokes, as I mentioned. Even once a vaccine arrives at its final destination, there are processes that the sites need to follow in order to get things ready before giving vaccine. Additionally, it can take a day or so for all those doses to get reported to MIC. All of that contributes to a bit of a lag. That's why the website shows 2,999 doses administered today. That reflects the most complete and final data to report this week. However, more doses are being administered every day in the state, and we have preliminary data that 11,578 doses have been administered as of yesterday. Again, we had to include what was fully complete and final on the web for our posting, but vaccination continues to happen across the state. As I've said so many times, we know it's tough that there is not enough vaccine for everyone who wants it at this point. We have the priority 1A groups as recommended at the federal level. Those are the healthcare workers and long-term care residents. And because of the limited vaccine supply that we knew that we would be facing in these early weeks, we had to further sub-prioritize that first priority group, because even within that, we knew we wouldn't have enough vaccine for all healthcare workers and residents, long-term care residents right away. So we have 3 tiers within this highest priority group. Tier 1 is focused on providers who are at higher risk, such as those who directly care for COVID-19 patients. Having said that, I want to acknowledge that community clinics are very important partners. The scarcity of vaccine at this earliest stage means the demand far exceeds the supply, even for most at-risk areas. Community clinics have an important role in delivering care to Minnesota's underserved populations, and their staff will be among the first Minnesotans to have access to the vaccine in this phase 1A. We've prioritized them for enrollment as providers. They were invited to complete the provider agreement before other primary care clinics, and 14 of 17 have done so already. However, the Minnesota Vaccine Allocation Advisory Group determined that staff in clinic settings would come after other healthcare staff in acute and long-term care. And so staff in community clinics would be vaccinated with those other clinic staff. However, COVID testers that are in a priority group, that are in priority group 1, are those that are involved in testing centers that do high numbers of tests, oftentimes in somewhat uncontrolled environments, or are going out into the community to do testing. So inasmuch as a community clinic has staff doing that work, then they would be in phase 1A, tier 1. Otherwise, they would be in tier 3, just like other outpatient clinics. Then I just want to acknowledge that we've heard that the national distributor for Moderna has told us that they are behind on shipping vaccine. We've been made aware that there are 4 providers in Minnesota that will have their shipments delayed, and obviously the impending weather that we're experiencing right now is further complicating those shipment plans. But there are 4 providers, 3 local public health agencies, and 1 skilled nursing facility. So we're continuing to monitor the situation and keep those providers updated. We certainly are always concerned when there are logistical challenges at the national level, and so we'll continue to keep you updated on that. We have a strong plan in place to vaccinate Minnesotans to help end the pandemic as quickly as possible. And our goal is to make sure that everyone who wants to be vaccinated has access to the vaccine so that we can reduce mortality, long-term problems, and health inequities. But we can only be successful at that when we have vaccine in the state. So we'll continue to update you on that situation. And then we've talked a lot about vaccine safety and how these vaccines, the Pfizer and Moderna vaccines, have gone through the same rigorous safety expectations that any of the other vaccines that we use have gone through. And they also will have the same post-approval monitoring, meaning that we will continue to monitor their safety even after they've been approved by the FDA. And one of the things that will contribute to that is a program that CDC has developed. It's called vSafe, and it's a reporting tool that uses smartphones for active monitoring for COVID-19 vaccine safety. So It's something that you can download to your phone. It uses text messaging and web surveys to check in with people who have received the COVID-19 vaccine, and participants can report side effects and health impacts following vaccination. And it can serve to remind you when you need your second dose. So people who are getting their first dose of COVID-19 vaccine, that is the healthcare providers who are receiving it now, should be given information about V-Safe. So if you're getting vaccinated, expect to learn about it. You can also find information on CDC's website, and we would encourage people to download this and use this when they are vaccinated. So with that, I will turn it back to Andrea.
Thank you very much. And operator, we are ready to take questions.
Thank you, ma'am. At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Your first question comes from the line of Emily Havoc from Care 11. Your line is open.
Hi, Jan and Chris. Thanks for taking my question. Could you give us sort of a broad view of the numbers we're seeing lately? We're seeing the lowest case numbers we've seen in 2 months, but we keep seeing deaths spike up to really alarming points. So can you explain a little bit what's behind these low case numbers and high deaths? And also, you know, we're seeing the deaths really go up and down. Sorry, that's my dog. We're seeing the deaths go up and down quite a bit. And so is there anything behind that, a pattern, or does it feel a little bit random at this point? Thank you.
This is Jan. I'll ask Chris to respond primarily here, but just to say once again, yes, the decline in the case numbers is very significant and very, very welcome. But just again to reiterate, we're still at extremely high levels of cases, comparatively speaking. If you look at those population-based numbers, the number of cases that we have per day on average per 100,000 people, we still rank very, very high nationally in terms of how widespread this virus is. So it's relative to our peak, we're definitely in much better shape than we were a month ago, but we are still in a situation where there's just a lot of virus still circulating in the community, which is why we keep on emphasizing that we think this is still a situation in which people just need to be aware of the risk of contracting the virus when we're gathering. But in terms of the relationship between the falling case counts and mortality statistics not falling to the same degree, to some degree that's just sort of the lag between cases and hospitalizations and mortality. But I would ask Chris to comment further.
Yep, thank you, Commissioner. No, that's what I was going to say as well, is that both hospitalizations and deaths are lagging indicators. And what that means is that even as we see cases start to increase, we don't see the resulting hospitalization and death increase for a number of weeks. And if you think about it, it makes sense in that, you know, most people don't develop an illness and instantly become critically ill and die. You know, there's a progression in terms of, you know, developing an infection and illness and becoming more and more ill. So it's a lagging indicator is the way we describe it. So as we were looking at the highest case numbers in November, we weren't seeing necessarily, we were seeing our deaths increase, but we weren't seeing the highest number of deaths in November. We've had a December with the highest death counts, and that is because in December we are sort of reaping the effect of the November high case counts. And then, you know, the day-to-day variability really has to do with as these reports are coming into us. So we expect to see variability between days, but when you look at the overall trend of high death numbers, it really is the outcome of the high numbers in November. So we hope that because of the work that Minnesotans have done to get our case numbers down, that as we move into January, we will have the benefit of seeing our deaths decrease as well.
Thank you. That's really helpful. And then just, I apologize. Just a quick follow-up on the 4 providers that heard their vaccine shipments were delayed. Is that Moderna vaccine?
Yes, it is, and we have reached out to those providers, and so we're working with them on the details of, how we can make arrangements so that that the vaccine comes at a time when they're available to get it. As we're moving into the holiday weekend, we want to make sure that people are available to receive the doses as they come. But yes, we are working with them, and it is Moderna.
Thank you.
Your next question comes from the line of Catherine Richard of Minnesota Public Radio. Your line is open.
Well, I think it's a Christmas miracle because you guys have answered all my questions. So I will pass and move on to whoever's next. Thank you.
Well, that's actually a present for us too, isn't it, Commissioner?
Yes. Glad to be of service.
All right. And your next question comes from the line of Stephen Joyce from Bloomberg. Your line is open.
Hello?
Mr. Stephen Joyce, are you on the line?
Perhaps
All
we
right.
can move to the next one.
We'll go to the next
come back
question.
to it. Yep.
All right. Your next question comes from the line of Bill Werner of Minnesota News Network. Your line is open.
Hi, Commissioner, and hi, Chris. I'm sorry I'm going to have to be the Grinch and ask a question this time. I'm wondering if you can give us a rough idea, maybe without getting too heavily into the numbers, but the initial distributions of vaccine, what kind of percentages are going to healthcare workers, the highest priority, obviously, versus long-term care, specifically skilled nursing home residents for actual vaccinations? And given those numbers, how are those being prioritized so that they fall out that way?
Sure. This is Chris, and I'm happy to take that. So the initial doses that came into the state from Pfizer, and to remind people again, Pfizer is the minus 70 degree storage vaccine. So that vaccine has to be stored at minus 70 and can only be shipped in increments of 975 doses. So that vaccine that came into the state was directed toward the hub locations and spoke locations. And so that was mainly for healthcare, acute care, those types of settings. For our skilled nursing facilities, which is our first priority in that phase 1A, tier 1, we are using the Moderna vaccine. And so the doses of Moderna vaccine have been set aside for that population to a large extent. And that's twofold. It's more flexible. We can move it around the state in a more nimble or nuanced manner because it can be sent out in 100-dose increments. So those vaccines were made available both to the federal program, the pharmacy partnership with long-term care program. So doses are being, assigned to that program and will be used that way, as well as we've also made doses available to state partners who will be vaccinating in long-term care. So at this point, it's really the Moderna vaccine that has been, to a large extent, targeted to that population.
Are you able to give us any idea of rough numbers? How many folks I know we said, I think 11,500 vaccinated so far. Are those all healthcare workers, or is there some portion of those that are are residents of skilled nursing facilities? I'm just trying to get an idea, at least initially, coming out of the gate, what the relative percentages are.
Sure. Yes, very good question. I'm sorry. So in terms of the allocation, it is the Moderna vaccine, and that came in at 94,800 for the first week. And so that vaccine, in essence, was going to those residents and the staff of those facilities. When we're talking about the proportion of people who've already been vaccinated, the Moderna vaccine is just coming in this week. So of that 11,500 some healthcare workers that I mentioned, that was really in acute care. That was not focused in long-term care at this point. That will be starting next week.
Okay, I would suspect some people are wondering who have loved ones in skilled nursing facilities. What can you tell them about the prospectus, perhaps, for having that level of protection for their loved ones? Will a significant number be by the end of the year, do you think? Or you understand why I'm asking that. Can you maybe enlighten us on that, Chris?
Certainly. So we expect that as this vaccine has come into the state, that next week that there will be vaccination that begins in those settings. And so there'll be multiple partners, pharmacy partners, that will be starting to vaccinate. And as we get more information, we can let you know what proportion of that population has been vaccinated, but we expect that vaccination will be starting for our skilled nursing facilities next week.
Thank you very much. I appreciate it.
Your next question comes from the line of Ms. Sue Kraft from Monoman Pioneer. Your line is open.
Yes, can you hear me?
Mm-hmm. Yes, we can.
Okay. How many cases of reinfection with COVID have we seen in the state of Minnesota? And does the vaccination protect against all strains or variants of COVID that we are seeing in the United States?
Chris, you have that one?
Yeah. So in terms of reinfection, I think we talked about this a number of weeks ago on a call, but in order for a situation to be referred to as a reinfection, and you've probably seen this in the media, both in the U.S. and around the world, you actually need to have laboratory specimens for the first illness and the second illness so that you can compare the whole genome sequence and say, you know what, the first illness looked like this, and we're looking at the second illness, and it is different. The whole genome sequence is different from the first illness. And so that's something that is not we don't often have access to that kind of a thing. We've certainly gotten over 100. I think when we talked about this the last time, it was about 125 reports of people who felt that they had COVID and then, were reinfected. But in the absence of that laboratory evidence, we can't really comment on that because we don't have that clear information. We certainly know that people can be reinfected. And then your second question, you asked about reinfection, and then the strains.
Is the vaccination is effective against all strains or variants of COVID that we're seeing in the United States?
Yes. So the expectation is that the vaccine that is now available would be protective against what we're seeing circulating in the United States. And it's effective both for people who've had COVID in the past as well as for people who have never had COVID. It has a really high level of effectiveness.
Okay, thank you.
We now have Stephen Joyce from Bloomberg. Your line is open.
Sorry about it earlier. That was my fault, not the operators. A couple questions for Director Erzman. And the 11,578, those were as of yesterday in the morning or the evening, or what time, do you know?
Chris, have you got that one?
I'm sorry, I was on mute.
Yeah.
Probably what happened to you the last time. So
Yes, catching. I'm sorry.
I guess it's a tit for tat here. Yes, that is pulled in the morning. So that would have been as of yesterday morning.
Sorry to say this, but my editor's going to ask, is it 9, is it 10, is it 6, is it noon, is it something?
It's mid-morning.
Okay. And those are all Pfizer, is that correct?
Yes, because the
Okay,
Moderna vaccine is just coming in.
Right, and you said earlier, needles and arms on Moderna next week, right?
Right, because that vaccine is just coming in. I think that's one thing that we want to make sure that people are aware of is that when we report doses allocated, then between the time that the vaccine is allocated, it has to be shipped and delivered and sort of incorporated into the whole vaccination plan. And so, for instance, for some sites in Minnesota, they didn't even receive their Pfizer vaccine until last Friday. So we just want to make sure people are aware of that there isn't a lot of vaccine that's just sitting around. There's a lot of vaccine that's moving around, but it's not sitting around waiting to be used. Once it arrives, it does get used.
Okay, thank you for that. And then my question is this, what can you tell us about this, and this is my term, not your term, but this shipping glitch with Moderna? What happened?
We were just made aware that they were behind on getting the Moderna vaccine shipped out. And so because of that, we were reaching out to the providers that we knew that hadn't received vaccine. And here in Minnesota, the weather we're kind of moving into a winter storm situation. So we have both the situation that's happening at the national level with a bit of a delay in shipping, and then we have our own weather situation. And so we are working with the providers to make sure that we can have them available to receive the vaccine when it does come.
Great. Thank you very much.
Operator, we have time for one more question.
All right. We have the line of Ms. Catherine Richer from Minnesota Public Radio. Your line is open.
You guys are having to close some testing sites over the holidays this week and next week. Is this going to create any sort of blind spots as you are thinking through those next decisions around reopening? Will you be missing on critical information that will help you make those decisions?
It's a great question, Catherine. This is Jan. Certainly we will look at broader trends and bigger pictures. We will try to make some extrapolations of what we think the impact of just under testing and under reporting is over the holidays. But I certainly would invite Chris's comments too. I don't think that will be data that is so sensitive that couple of day period would throw off broader trends in a meaningful way. But Chris, please feel free to differ with that if you see it differently.
No, I agree completely. I mean, obviously, you want to have data, as much data as you possibly can, but yes, a couple of days won't make a difference. And I think, as the commissioner said, in previous conversations, we look at, there are multiple factors that go into evaluating these decisions, and certainly test positivity is one of many factors. So it's multiple factors, and it's data from multiple days. So 2 days of testing will not be a problem for being able to evaluate the situation.
Sure. And while I have you guys, I was just perusing an article in the New York Times about the Eli Lilly product and the Regeneron product, and just how nationally, at least, it's the uptake on it has not been what providers expected. And I guess I'm just wondering, where do things stand on that from your perspective? Do you have a sense of how many of those treatments have been given out at this point? Is it something that's being used around the state pretty widely? I know Mayo has the Eli Lilly product, but I'm unclear on, where else folks might be able to get those products if they wanted them.
Chris, do you want to start on that? And then I'll just comment on our conversation with Dr. Redfield.
Sure. Well, certainly we have a team that's been working on both looking at the ethics of allocation as well as the fact that, there are certain like parameters, like they would like to use it in outpatient settings, and that becomes more complicated in terms of administration and just how to make that happen in a timely manner. So I think that in this case, in this situation, there are some logistical challenges that may be impacting the uptake, in addition to, any of the other things that we deal with. So I think it's a little bit more complicated in terms of the logistics. So that certainly has been a factor. But I think I could refer you, if you're interested in more detail, to Dr. Sarah Lim or Dr. Ruth Linfield, who've been working really on the details of making that available in Minnesota.
And no sense of how many doses, for instance, have been given out at this point?
Nope, I don't. I'm sure they do. And like I said, we can connect you, but I don't. I'm afraid I can only keep the vaccine numbers in my head.
Fair enough. Okay.
Yeah, and I was just going to add, this is Jan, that a few of us had a chance to talk with Dr. Redfield, the CDC director. And Chris, the days are mixing in my head. I can't remember if that was late last week or early this, but he was making the point as well that if we can, and Chris spoke to this, if we can kind of move the focus of administration of those treatments from a hospital setting to an outpatient setting, that would be of even more benefit. And yes, because there hasn't been as large of an uptake yet, from a supply standpoint, we would at the present time have the ability to get more of that happening in the outpatient setting if we can work through some of the logistical challenges. But yeah, I think it's a good idea to connect you directly with Dr. Linfield and Dr. Lim to get more specifics.
Okay, thank you.
Thank you very much, and that's all the time we have for today. If there was a question that you were not able to get answered, please feel free to reach out to our media team at Minnesota Department of Health. Thank you and have a great afternoon.
This has been a WDIO News Special Report.